Situational Judgement Lesson 4, and this lesson is all about how to approach a scenario and how to go about deciding whether factors are very appropriate or inappropriate, or very important or not important. So first of all, there's a step-by-step strategy to approaching scenarios, and the most important thing to do first is identify the main player. So questions will switch between you being a medical student, you being a junior doctor, you perhaps being a consultant, or being a member of the public. So it's important to work out who are you being in this scenario, because that will affect how you react in some situations, or how appropriate some actions are, or how important some factors are to consider. So step 1 is to identify the main player in the scenario. Step 2 is work out the main problem at hand, and also how serious that problem is, because the seriousness or the severity of the problem can often influence, again, how appropriate certain things are to do, or how important certain factors are to consider. So step 1 was identify the main player, step 2 is identify the main problem at hand, and step 3 is make sure you read the statement or the response that you're given to the scenario carefully to make sure you understand the situation. And then, obviously, sometimes we have appropriateness questions, which we went over in lesson 2. So your responses will range from very appropriate, which is the absolute best thing to do, causes no negative impacts and deals with the key situation at hand. Appropriate but not ideal, where your response does deal with the situation at hand, but perhaps there was a better way to do it. Inappropriate but not awful, where you haven't taken a good approach, but the negative consequences are minimal, but they are possible. And then finally, very inappropriate, where what you've done will make the situation worse or will have negative consequences. Or we've got the importance questions, where, as we went through in lesson 3, you can have very important, which is something essential to consider for the scenario. It will really change how you react to a situation. Important, where it's a vital factor to consider, but actually not completely essential in that scenario. Of minor importance, where the factor is mildly relevant and it wouldn't hurt to take it into account, but it probably won't change how you act whether you take it into account or not. And finally, not important at all, where the factor is irrelevant to the scenario and won't change how you act at all. And it's really important when you're approaching these scenarios to look at what you should do versus what you would do, perhaps, as yourself. So when you're doing the situational judgment test, it's important to not answer questions based on how you yourself would probably react in real life. You need to put yourself in the situation of being the nurse, the junior doctor, the consultant, whatever you're meant to be in this question, and react in the most appropriate way for the professional setting of medicine. This isn't trying to work out how you would react as you in real life instinctively. Okay, so in the situational judgment, act how you think a doctor should rather than how you would. And sometimes the questions are a little bit more confusing because they're in non-medical settings, but you still need to apply the medical principles of professionalism, integrity. You can bring in the medical pillars of ethics, and you need to respond accordingly to those, even if it's kind of a real life scenario rather than a hospital scenario. So always ask yourself, what would a medical student do? What would a GP do in this situation? What NHS values am I meant to be thinking about in this question? And respond appropriately, bringing that into account. An example of this is the scenario might be, in the classroom, one of your friends has cheated in an exam and has told you about it. And in real life, you might, be in the position of being their friend, and you might neglect that action. You might not report it to the teacher. You might pretend you've not heard it. Whereas if you're acting as a junior doctor, you would have to report this behaviour because it's, bad professionalism. And that is something that you need to report when you're in a doctor mindset. That's just an example of kind of what you would probably do versus what you should do in the situational judgment test. Next point about when you're approaching the scenario is make sure you judge each response as an independent response. So let's say you're given a scenario and a response to that scenario. If you think it's a very appropriate response, that's great. Don't treat it as if that's the only response that will occur. Sometimes there are multiple actions that are really appropriate to do or very important to consider, and it's very fine to put very appropriate to multiple answers. I think sometimes people get a little bit scared and try and kind of give very appropriate to one answer, appropriate to one, not very appropriate to one, and then completely inappropriate to one. And they're a bit scared to put the same answer for multiple responses, but sometimes that is the case. Because just because something is the optimal approach doesn't mean that it's the only approach that is optimal. Example for that, so if a GP wants to do a blood test, there are several things he may need to do that are very important or very appropriate or appropriate. So all of these 5 things listed would be at the higher end of this scale, and it can be intimidating if you got this as a question and these were all the responses that you had to rank from A to D, very important to not important or very appropriate to not appropriate, and you were putting very important or very appropriate for all of them. It's a bit intimidating on the exam, but don't be scared to do it, because if you look at all of these factors, they are all very appropriate or very important things to do. And when you're looking at whether a response is going to be very appropriate or very inappropriate or not, there are 5 domains of response that you can look at. So mistake acknowledgement, clinical response, patient communication, documentation, and colleague communication. And if we go through those in a little bit more detail with an example to make it easier to understand. So example is a medical student hears about a fellow medical student accidentally breaking confidentiality. So when we work through these domains, the first one to consider here is mistake acknowledgement. So it's very important to acknowledge that your colleague has made a mistake and make sure you speak to him and alert him to his mistake to make sure that he doesn't do it again. So mistake acknowledgement is first of all important for realising that something's gone wrong, and second of all important for making sure that it doesn't happen again by either alerting the person or recording it in some way to make sure nobody else makes the same mistake. Second thing that you need to consider, I've half touched on already, is documentation. So make sure you write down and record any mistakes that have been made by the medical student so that there's a record of what's happened. Third thing to consider is clinical response. So you need to make sure that the medical student breaking confidentiality hasn't affected the clinical diagnosis or prognosis of the patient. And this also becomes relevant in situations where perhaps a mistake made was more of a clinical mistake rather than a confidentiality mistake, such as administering the wrong drug or giving a drug that the patient is allergic to or making a procedure go wrong, in which case it's even more important to check that the clinical diagnosis and prognosis of the patient hasn't been affected and that any adverse effects the patient experiences are counteracted clinically as soon as possible. The fourth thing to consider is colleague communication. So in this case, you've obviously already communicated to the medical student that they've made a mistake in mistake acknowledgement, but you also need to communicate it to perhaps a more senior colleague, so report the breach of confidentiality to the consultant or a registrar to make sure that people know what's gone on and people know about the mistake and ensure that it can be fixed as much as possible. And finally, there's patient communication, which can sometimes be the most important one. So you need to communicate with the patient, especially if they've heard about the breach of confidentiality and they're upset or they're angry. You need to communicate with them, you need to apologise, assure them that they're in the best hands. So when you're, again, approaching the scenario and comparing the different responses, we've spoken about how there can be several responses that are very appropriate things to do, which is why it's not always useful to compare all the responses and try and rank them against each other, because some responses will have the same answer. But sometimes it can be very useful if 2 responses are very similar to look at the differences between them and see what the minor difference is and whether that makes the response more appropriate, less appropriate, more important or less important. So most of the time, look at each response independently and try and rank it on its own, but some of the time it may be useful to compare 2 responses that are very similar to see which one you think is more appropriate or more important. Also, it's very important to consider short-term and long-term effects of the responses you're looking at. So if you think one of the responses is quite a short-term solution that is likely to cause long-term impacts, or the other way around, it's going to cause, it's a long-term solution that's not going to solve things in the short term, that can affect how you answer the question. So an example of this would be if you find that one of your colleagues is not doing very well, instead of speaking to them and, as you fear they won't listen to you, you go straight to higher authority and report them to perhaps a consultant. In the short term, this might mean that they improve their behaviour because the consultant will speak to them and that's a higher authority getting involved. But in the long term, it's going to affect team morale because their trust in you might go down or their confidence in confiding in you might go down. So this response is effective short term, but perhaps not so great long term. And other responses where perhaps you watch and wait and don't do anything might be a good response in the long term, but short term aren't solving the issue. So it's very important to think about time periods when you're considering answers as well, because that can factor into your decisions. And finally, we're going to go over, if you think something's a very appropriate thing to do, little checks that you can do just to check that you've got the right track. So ask yourself, is this solution local and direct? Are you dealing with the situation as directly as you can and involving potentially as few people as possible? Are you putting the patient first, patient safety and confidentiality first? Are you maintaining the integrity of medicine as a profession and maintaining trust in the NHS? Is it the best possible response in the 5 domains that we explored earlier? Mistake acknowledgement, documentation, clinical response, colleague communication, and patient communication. So when you're thinking of putting very appropriate, just ask yourself these 4 questions and see if it really is a very appropriate thing to do. Now, something that comes up quite often that people struggle with a bit more is, do we need to ask for higher authority? Do we need to get a consultant or a registrar involved? And the main rule is always try and resolve any conflict or issues directly and locally, so only raise it to higher powers when necessary. And when is necessary? That's the tricky part of the questions. So a very good rule to follow is only report to higher authorities or higher medical professionals if the situation involves patient safety, patient confidentiality, or data handling. So for example, I'm a doctor and I saw a fellow doctor smoking directly outside of the hospital instead of the designated smoking area. Should this be reported to higher authority? Well, we ask ourselves, is patient safety, patient confidentiality, or data handling at risk? None of those are at risk in this scenario, so although technically you probably should report them, it's probably more appropriate to just speak to your colleague and warn them first, and then if they do it again, that's when it would be appropriate to report it up to higher authority. So you first try and deal with the situation locally and directly, and then report it up to higher powers if that doesn't work. Another example would be, I'm a dentist and I saw a fellow dentist tweet about a patient's breath in his afternoon shift break. He said it smelled bad. Should this be reported up to higher authority? Yes, because patient confidentiality is at risk. So the post needs to be taken down as soon as possible, and this also needs to be reported up so it can be dealt with appropriately. The next scenario is, I'm a medical student and I had a friend who was a fellow medical student who missed class frequently. So have a think, does this need to be reported to higher powers? Well, patient safety may be at risk in this situation because if the medical student is missing class, they might not know things that they need to know to work on the ward. However, you could also solve this directly with the medical student because there might be a reason that they're missing class and it could overcomplicate things to report them or make any situation they're going through worse by getting higher powers involved. So this one's quite a tricky one because obviously you could solve it locally and directly and try that way first and then report to higher powers later if the student is still missing class, or you could just reveal this immediately by reporting up to a higher power. And another example, I'm a medical student and I'm studying in the library. On the table I find a whole list of patient details. Should this be reported up to higher powers? Well, obviously in this one, data handling and patient confidentiality at risk, so the immediate direct and local action that needs to be taken is to remove the list of patient details and shred it or dispose of it in some other way. But also this does need to be reported up because there's potential breach of 2 of our important factors, confidentiality and data handling. So looking at this scenario again, a junior doctor has been asked to perform a blood gas on a patient for the first time. She's done it lots of times at medical school, but is struggling to cope with the pressures of working in a hospital. And in this scenario, she's failed to do the procedure the first time. How appropriate are the following responses? So this response here we have is immediately ask for consent to carry out the procedure again. So when we approach this scenario, what are we thinking about? We're thinking about all of these categories from very appropriate to very inappropriate thing to do. We're thinking about the 5 domains of response that we went through earlier. We're thinking about local and direct action versus reporting to higher powers. So when you think about this one, what do you think the answer would be? And this would be inappropriate but not awful, because we've not really communicated very well with the patient. We've not apologised for the procedure not working the first time, but it's not awful because we are asking for consent, so the patient could say no to it happening again. But yeah, it's inappropriate because the patient hasn't been fully communicated with. There's the option of maybe bringing in a colleague, which would have been better, but it's not awful because the patient can always say no, and we have got consent in the scenario. Another response could be apologising to the patient, reassuring them of their safety, and then asking for consent to carry out the procedure again. So thinking about all the factors we've talked about, what do you think the answer to this would be? And this is very appropriate because we've communicated with the patient, we've reassured them they're safe, we've maintained their trust in the healthcare professionals, and we've got consent to possibly try the procedure again. So this is a situation where it may have been useful to compare two answers. So in this response, we're apologising, reassuring, and then wanting to try again, whereas in the previous response, we just wanted to try again. So you can see how the addition of more patient communication has made the response more appropriate. Next example is a response being asked one of the more senior healthcare professionals to take the blood gas as she's afraid she will mess up again. How appropriate do you think this is? So this is B, appropriate but not ideal, because if the junior doctor keeps trying and failing, the patient might get frustrated or upset or angry or be in pain. So it's wise to get somebody else involved. However, it's not the ideal scenario because before getting somebody else involved, it would be better to try and deal with it locally and directly and see if the patient is willing for the junior doctor to have another try. And that is the end of lesson 4. If you liked this video, make sure to subscribe by clicking down below. Click here to continue watching our UCAT series and to unlock full access to the course with over 70 tutorials, hundreds of practice questions and flashcards. Click on the link in the description below now.